So today we're going to be talking about three bony landmarks. One, the Acromionclavicular Joint, the sternum, and the thoracic vertebrae. So let's get into it. Right? So what are we looking at? We're looking at the clavicle, also known as the collarbone. This right here is the sternoclavicular joint. Reason why they call it the sternoclavicular joint, because this is the sternum, this is the clavicle. So it's the sternum clavicular joint. This is medial. Anything medial is towards the midline of the body. Anything lateral is away from the midline. So, being that we're talking about the acromion clavicular joint, lateral to the clavicle is the acromion process. The acromion process is a part of the scapula, which is also attached to the coracoid process, and it forms a snug fit for the glenohumeral ball and socket joint, which is the upper arm. Turning it towards the posterior angle, you see that this is the spine of the scapula. This is the supraspinatus, infraspinatus. Several muscles attach to this acromionclavicular joint. This is where they're joined. But what joins them? Connective tissue called ligaments. Ligaments connect bone to bone. Tendons connect muscle to bone. So let's look and see what muscles we have. All right. So this here is the pectoralis major that connects to the acromionclavicular joint. You also have your deltoids, your sternocleidoid mastoid, and your trapezius muscle. What do these muscles do? They help with elevation of the scapula, depression of the scapula. It helps with adduction of the arm and flexion of the arm. Let's move forward to the sternum. Okay. The sternum is in three segments. The manubrium, this is the sternal angle, or they may call it sternal ridge for some. This is the sternum, the xiphoid process. What is this for? This is to protect the esophagus, the trachea, and your heart. It is a flat bone surface. It is also connected to the upper seven ribs, and through the eighth through the 10th rib, it is connected indirectly by costal cartilages. Tendons also connect to the sternum, which are connected to some of the major muscles, such as the pectoralis major, the sternocleidoid mastoid, the sternohyoid, and the sternothyroid muscles. Last but not least, we're going to talk about the thoracic vertebrae. One of my favorite bones in the vertebral column. Okay. So what are we looking at here? Let's zoom this in. What are we looking at here? This is the body. This is the facets. This is the transverse process and the spinous process, right? These right here, the transverse process, is where the spinal cord and the nerve endings come out through the side, and it gives off signals for movements, breathing, and so on and so forth. The spinous process in the thoracic vertebrae, it is much longer and it is stacked. So it prevents extraneous movement So you can't bend all the way back and things like that. That's what that's there for. They're stacked on top of each other. In the cervical and the lumbar, it's not like that. The lumbar section of the vertebral column, the bones are much bigger to withstand a lot of pressure. The cervical are a bit smaller and they're shaped different due to different functions. Now, this here doesn't have a transverse foramen. This here, anything, a hole within a bone is called foramen. So in the cervical, you will see that they'll have a transverse foramen to protect the major arteries that's delivering blood to the brain. Now, from here to here, this is called the Lamina Groove. What is in the Lamina Groove? You have two major muscle groups. One is the erector spinae group, and deep to that is the transversal spinalis group. The erector spinae group is superficial to the transversal spinalis. What is superficial? Superficial means anything that is closer to the skin and easy to palpate. Palpate means to touch and feel. Deep means it's further away from the surface. So medial going lateral. For the erector spinae group, you would have your spinalis muscle, your longissimus muscle, and your iliocostalis. Deeper to that, you'll have your rotators, multifidus, and you have your semispinalis group. They help with flexion of the body. They help with medial, lateral rotation, and lateral flexion, bilateral flexion. But let me show you the difference between the cervical and the thoracic bones as far as the transverse foramen. So this is what I was saying. You see the spinous process and the lamina groove is much different. And the vertebral foramen is much different, shaped different as well. The transverse foramen, now what I was telling you about, that covers the major arteries. You see that that's there. And you won't see that setup for the thoracic and the lumbar. Now, let's see if you guys can also see. I'm not sure if you guys can see it. Okay, well, this is how the spinal cord is. Concave, convex, concave. So this would be called lordosis. Lordosis is concave. Kyphosis is convex, which means it curves out. So the cervical is concave, the thoracic is convex, the lumbar is concave, the sacrum is convex. And that's pretty much it for the acromion.